Okay, folks, here we go. Good afternoon. Come on, you can't be too tired yet. It's only 4:10. We've got lots more programming to go. But seriously, good afternoon. My name is Ruth Katz. I'm the Executive Director of the Aspen Institute's Health Medicine Society program. I'm also a co-producer of Spotlight Health. We're delighted to have you here and hope that the last 1.5 days, we got a little more to go, that you've enjoyed yourselves. We're delighted to have you here. It's my pleasure to introduce our session this afternoon, How Race and Place Influence Health. And it is further my great honor to introduce our moderator this afternoon, Maria Hinojosa, who as... Well... No further introduction. Our moderator. There we go.
Oh, I love that. Thank you.
I do have to add one thing that isn't in the little bios that you get. This is Maria's first time here at Spotlight Health as a moderator. I've already said she better be back. Thanks for being here.
Thank you
thanks
so much.
To our panel.
Thank you for the warm welcome. So what you guys don't know is that my dad, Dr. Raul Hinojosa, may he rest in peace, was a medical doctor dedicated to research, otolaryngology, and was part of the large team that created the cochlear implant. So, you know, it means something to me. Yeah, he was that geek who was in the electron microscope every single day. Before we start, I want the panel to introduce themselves by saying who they are, what they do, and then something kind of geeky about yourself and how you're feeling. Just really quickly. So I'm Maria Hinojosa. How am I feeling? Particularly challenged as a Mexican immigrant woman journalist in the United States of America. But in order to keep my health and my quirkiness is that I call myself a succulentologist. I have lots of succulents in Harlem. I do boxing and I meditate now religiously, and that's what's keeping me sane.
Wow.
Ooh.
Wow.
Rich.
Wow. I'm Rich Besser. I'm President and CEO of the Robert Wood Johnson Foundation. I would say that I'm hopeful during really challenging times. And I think some of what gives me hope are the conversations that I have here, especially with some of the younger people who are here who are working at the community level to see the change they believe in take shape. At a personal level, in terms of staying sane, meditation and yoga are part of it. The exercise is absolutely critical to my mental health.
And the quirky would be?
Oh, quirky?
The president of a foundation and a former television correspondent. But go there, quirky.
Yeah, so quirky. So yesterday I was the geeky guy doing yoga at 7 a.m. It was not pretty, and it seemed like no one had gone by, but there've been like a dozen people who walked by and said, "Oh yeah, I saw you doing yoga." And if there's anything that's going to get me to stop doing yoga, it's the fact that people saw me.
People are trying to send you some love. All right, Kathy Cochin.
Hi, I'm Kathy Cochin. I'm the President and CEO of the Asian and Pacific Islander American Health Forum. We're the nation's advocates for Asian and Pacific Islander communities in federal health policy. I identify with being the child of immigrants, second generation, born and raised in Cleveland, Ohio. Let's hear it for Cleveland. That's kind of quirky. And one of the things I do to keep myself sane is play the piano. Yes, I'm one of those Chinese American kids who, had to learn how to play piano at a very early age, and now it's their gift to be able to sit down and just, lose.
Okay, but quirky?
Oh, quirky. Oh my gosh, quirky. My husband says that I have too big a shoe collection.
You're another Imelda?
Yes.
Oh my God. My husband calls me Imeldita. I will be walking in flats on the entire campus, but you will never see me on stage in flats, I'm just saying. Okay. Kevin Washington.
Kevin Washington, President and CEO, YMCA of the USA, located in Chicago. And what do I like to do? Quirky. I'm not quirky at all, but let me just say golf keeps me, and anybody that plays golf.
Not quirky.
It can be quirky sometimes. And it's also a game that is humbling. It keeps you humble. The other thing is I'm optimistic. You know, working with young people, you will always be optimistic. Because one of the things we know, change has never happened anywhere without the young people leading the charge. And the opportunity to be around young people on a regular basis keeps me hopeful. So I say the glass is never half full, empty, it's half full.
Okay. I will take it. I'll take optimism. Seriously. Okay, so we're talking about race and place and health. Rich, why don't you just kind of set the stage? Because this is, you know, it is like your obsession, frankly. It has become that, right? I mean, it's like a lot of your thinking now is revolving around this. So kind of set the stage, and then we're going to have a conversation amongst ourselves. And as soon as that happens, if you guys have a question, just raise your hand. I'm very interactive, and I really want to hear what you guys have to say. So raise your hand, even if it's in the middle. Raise your hand. I'll see you. I'll acknowledge you. We'll get the microphone, and we'll make it more interactive. All right, Rich.
So, yeah, this is an area which, at the foundation, we are absolutely passionate. We're the largest health philanthropy in the country. We've taken on issues like smoking in America, obesity. About 5 years ago here at Aspen, we launched this big, bold idea, something we call the culture of health. And it's a recognition that as a nation, we spend more on health than any other country per person. And our results are absolutely terrible. We spend our money on sick care. We don't spend the money on keeping people healthy. And the idea of a culture of health is saying, what does it take to give people in this country the opportunity for health and well-being? What would it take for everyone in America to have a fair and just opportunity for health and well-being? And what's recognized is something that people in the field call social determinants of health. But it's a recognition that it's critically important to have connection to a healthcare provider who knows you, who you can visit for regular visits, who can take care of you when you're sick. But in terms of staying healthy, that connection is a very small part of it. Health comes about from where we live, where we work, where our children go to school, where they play. And for so many people in America, those conditions aren't there to allow them to lead healthy lives. They don't have access to affordable housing, to good schools, to food, to safe places for their kids to play. If you don't have those things, if you don't have jobs that pay a living wage or transportation to get you to those jobs, your chances of being healthy are absolutely terrible. So each year for about 10 years, we put out something called the County Health Rankings. And what this does, it looks at every county, almost every county in America, and it ranks them in each state by a number of health parameters. Premature death, days of illness, days of mental illness. And it looks at the factors that go behind those health metrics. So things like high school graduation, access to food, segregation, poverty rates, obesity rates, diabetes rates, teen pregnancy. It looks at all these factors, and it gives communities information that they can use to identify the problems they want to tackle, and then it gives them tools to do that. So we've been doing this for 10 years. This year, in addition to ranking by place, we broke the data down by race. And what we found when we looked across America is that it didn't matter whether you were looking at the healthiest county or looking at the least healthy county in a state. Black Americans, Latino Americans, Native Americans, their health indicators were lower. If you looked at something like premature birth, which is a big risk factor in terms of infant death, but also in terms of future health problems. Black babies about twice the rate of white babies. If you look at poverty rates, the poverty rates for Native Americans, for blacks, much higher. And those things relate to health. So if you don't look at things by race, if you don't break things down to that level, you're going to miss an important problem. You're never going to be able to accomplish what we talk about in terms of health equity. And that's making sure everyone has that opportunity for health.
But Rich, when we were speaking, you acknowledged that for a lot of people, talking about race is just, it's hard, right? It's a challenging conversation. I mean, it's kind of, yet again, the moment in our country when we are really thinking about this. So what's your message about thinking about this without the fear of a conversation around race?
A number of things come to mind. One is that you can't view the issue of race as a problem for minority populations to address. If as a white man of privilege, I can't talk about the issue of race and acknowledge, my level of understanding is not that deep. But if I can't talk about this as the head of the largest health philanthropy, we're not going to get very far. Yeah, and if we don't look at our programming that we're doing around the country through a lens of health equity, we're not going to get very far.
So, Kathy, here's what I was going to ask, but you can jump in. What I was going to ask is, so Kathy and Kevin, like, what are the biggest issues / misconceptions around the issue of race and place and health? But take it wherever you want.
Yeah, well, I just wanted to build on what you were saying, Rich, about the data and how important that is. And so in the Asian American, Native Hawaiian, Pacific Islander population, so we have people who come from 50 different countries, speak 100 different languages, and when you lump all the information together, it looks like Asian Americans, Pacific Islanders as one group are healthier than everyone else. In fact, time and time again, you see those reports that say that. But if you start to break it down by individual ethnicities, you really start to see what the inequities are, and that we do have certain populations that have these extreme inequities. And I can cite a lot of different things. I won't go into a lot of detail here about that. But to really dig deep into that so that really every person can be known. Each community's needs can be known and then really addressed in the ways that it needs to be.
So I immediately think of Guam.
Yes,
Because I went to Guam. My husband always says, "Ay, Maria, you go to the farthest places in the world, the most forgotten places, and there you find the most forgotten people." So I went to Guam, and I found military veterans who had PTSD who were not getting treatment. And when you think about, just life on Guam, it's gorgeous, but the food, a lot of fast food.
Well, the other thing in the Pacific Islands, so the United States is actually a colonizer in the Pacific, and there are six...
And also a challenging word. Only one person is snapping because one person gets it, but we're talking about race and stuff, and it's like that's a term that some people are like, what? Yeah. And it's like, it is, as per the United Nations, by the way.
Colonization is a huge issue, whether it's in the Pacific or in Native American communities or in South American and Central American countries. So, just to be real, right, we got to talk about colonization. But in the Pacific, there are 6 jurisdictions, 3 independent countries, the 3 territories, that are very dependent on the US economy. So that's where all of turkey tails and excess cheese is sent and all that kind of stuff. And there's huge rates of diabetes. And it's all driven by American economics and American colonization. And we don't know enough about those communities, or we don't spend enough time understanding what's happening in those communities to really address what those needs are.
So Kevin, unless you want to respond to that,
Go ahead.
I was just wondering what when you're talking about this, what are some of you must get a lot of misconceptions in terms of, what's the most surprising thing that you think you've heard when people are talking about this and you're like, wait, what?
Well, I'm not so surprised, but I would say this. As an organization that's in 10,000 communities across this country, we see every day the impact that race and health inequities have on communities. And our role in those communities is to try to open up access and equity through our process, through our organization, to ensure that we're looking at those really social determinants and being a solution to some of the issues that come into play.
And I'm going to stop you right there because I bet a lot of people are saying, wait, didn't Kevin say he's the head of the YMCA? Wait, what is that? What? So you need to...
I think that one of the things I'll always say, how many of you have had an association with the Y through swim and gym? See?
Whoa, a lot. You must be happy.
But,
uh-oh.
How many of you know that we are the largest organization that does diabetes prevention in the country?
Whoa,
How many of you know that through the work that we've been doing with Robert Wood Johnson, that we've been able to do some specific work around childhood equity?
Okay.
What I think is important is that what we have is an organization that has significant reach and potential. The ability to partner with organizations and entities that have specific skill sets, which we can scale through our network, has been what we've been challenged to do. We see ourselves as an organization where health and social come together. You just heard Rich say 10% of the health issue is about healthcare in and of itself. The rest is about other issues. And we think as an organization, we have the opportunity, I'll take that back, responsibility, to partner to change that particular paradigm. And the fact of the matter is being in those 10,000 communities has been helpful because we have been there a long time and there's a level of trust and connection that's been important for us to be trusted entities to help support those communities. While we are a national organization, my chief development officer said, but we're multi-local. And we start from a local perspective to do this work that we're engaged in from a health equity perspective.
Okay, Kevin, so take it from there and paint a picture of what you want to leave with the audience of, for you, when you're thinking about race and place and health. It looks like, I mean, I'm thinking just because Chicago, that's where you're based, I'm thinking about the fact that, you know, if you go into the South Side, or where I grew up, or the Southwest Side, and almost immediately you're going to see police,
Right.
fire. I mean, you're going to hear sirens. But if you're on the North Side, you never see that.
We know that where you live and what happens in those communities matters. We know that the Chicago has a significant issue of gun violence. We know that we have a program in Chicago that works with veterans who work with young men on the street to help them understand how they can prevent violence in their communities, particularly in the South Side. One of our YMCAs is doing that. So we do address those issues from a regional, but more importantly, a local community perspective.
And so when you think of race and place and health, what's the image that immediately comes to mind, Kevin? And then we'll go down the panel.
For me,
Yeah.
it's for me, because I grew up in this process, it's going to the clinic that the state runs and waiting in a long line to get service. And my mother bringing those yellow cards, those yellow cards that people stamp to make sure that that's what I remember about the healthcare system.
And how did you feel standing in those lines?
Well, it was a place for me to go to get service, but I also recognized I felt different. I was treated differently, clearly because who I am and where we were. I grew up in Philadelphia, in the South Philadelphia area.
Okay. Which has its own issues around race, I'm just saying.
Yeah, we know.
Philly, okay.
Right. So race and place. So there are enclaves all across, Asian enclaves all across the country. We know them as Chinatowns or Little Saigons. You know, sometimes you can think of them as like a tourist destination. But for the last 136 years, they've been places not only of ghettoization of those communities, but also for self-protection. At the end of May, on PBS, on the American Experience, was a really great documentary that I hope you guys can watch, which is called the Chinese Exclusion Act. So in 1882, the Chinese Exclusion Act was passed by Congress. It was the first law in the United States that excluded people by race. Now, obviously, we come to today, and that still has ramifications for how Americans and people seeking to be Americans are treated, up to the minute, right? But the problem, the biggest problem, not only for the last 136 years, is that it created a frame that talked about who is deserving and undeserving of being Americans. And that narrative, that master narrative, not only for immigrants, but really of all people of color, has continued to today. So it is really one of these things of, you know, if that's the frame under which all of us live, then what kind of protections do you need for your own self, your family, your communities? And living in concentrated communities are not only about ghettos, and you know, discrimination and redlining and not being able to buy anywhere else or live anywhere else, but it's also a matter of self-protection. We're just a few hours from Denver, where in 1880, there was a really vibrant Chinese-American Chinatown in Denver, and it got burned out. In Los Angeles, the same thing happened. Rock Springs, Wyoming, all across the country, right before the Chinese Exclusion Act happened. So we're seeing the reverberations of that today. And so as we talk about race, as we talk about place, we also have to talk about what is this master narrative that all of us are in many ways suffering under, because it's so hard to talk about these conversations. It's so hard to raise the pains that all of our communities have experienced. But we really need to do that in order to really try to address inequities.
Right, because we've been seeing it through a certain perspective. I mean, as you know, the news media today, the mainstream news media today, is less diverse than it was before 9/11. So, you know, Kathy's talking about the historical perspective, but there's also something that we're all living under today, and really trying to battle to actually take control of the narrative from a place of facts and stories. So, Rich, for you, what does it look like? Paint a picture in your mind when you're talking about what this looks like.
Well, I mean, something very concrete. Our foundation is located in Princeton, New Jersey, which also happens to be the town I grew up in. A baby born in Princeton, New Jersey, has a life expectancy of 87 years.
Whoa.
I work in a federally qualified health center in Trenton, New Jersey, which is about 12 miles away. The life expectancy for a baby born there is 73 years. So 12 miles, 14 years difference in life expectancy. And that's not unique to where we are. In Denver, depending on what side of town you're on, it's an 11-year difference. In New Orleans, depending on where you are, it's a 25-year difference in life expectancy. And that brings in all kinds of issues of both race and place. And when you're talking about race, you also have to be talking about racism, because it's, that's the underlying factor. You have to be looking at structural racism as a defining feature for these differences.
Yeah, in the note that I just put, it's been around for a long time.
Yeah.
That's exactly what I wrote down. So how are we to wrap our heads around the kind of lasting impact of a structural racism, structural inequality, which is a pretty big concept, when we're kind of acknowledging that talking about race can be a challenge? How do we bridge that gap? Because we're actually saying, and Kathy's saying, we got to look way back at the narrative. I'm going to say something that I know is going to be upsetting to a lot of you, but just for example, and I say it the way I'm going to say it to be provocative. It's not the words that I like to use and I never use. But for example, who were the first illegal aliens on this land? Right? We don't, the Pilgrims, right? We don't like to say that, but that is a different narrative, right? If it's told by the first peoples. So there's something about the narrative that is really important here. I opened that up. And by the way, okay, love that. Love that. We're going to take you there and then you here in the second row.
Someone thinking from a local level who works with a healthy eating, active living coalition, when we move into communities to create these, a culture of health within a community, how do we make sure that we're not just cycling place where these systemic inequalities occur?
That's a great question. That's a great question. And we'll take your question and we'll answer both on the panel. Yeah, right. We'll go ahead and take the next question right here. So we'll go 1, 2, and then we can have an opportunity to, we get many questions.
Another perhaps provocative statement, and take this as yes and, not instead of, but it's really important not just to have panels about racism, but to have the issue of racism present in every panel, because that's,
And what does that look like for you? Oh, okay.
Yeah, you guys.
Well, so, okay. Go ahead, Rich. Thank you. Ka-ching. There you go.
So one thing that we've done at the foundation, we had a health equity team at the foundation. And the responsibility of that team was to look at our grant making around projects that promoted health equity. And as we looked at that, we recognized that health equity wasn't something that sat over here. It had to be something that was in everything that we do. So we've restructured that. And we no longer have a health equity team. we have health equity in every single program that we're working on, and it's aspirational. Because I can tell you we're not where we all want to be, but we are looking at all of our work now through that lens, so that it's not just a conversation on the side of, okay, let's talk about equity today. We talk about equity now in every grant that we're thinking about making.
And I would echo, when we do work with programmatic activity, our diversity, inclusion, equity person is engaged in all of that process. It's not a separate part of who we are, is what we do. And when we go into communities, and when we're working, we have to meet them where they are.
Exactly.
We can't impose our will on them, but we meet them where they are and work with them, because every community has great assets. You might not understand or know where they are, but you meet them where they are and you work from there.
And sometimes an entity, a program might get funded for a certain kinds of set of activities, and you go to a community that you want to work with, and that's not what their priority is.
Right.
Well, you have to work with, exactly like you said, you meet the communities where they are, really listen to what they need, and really make sure that those who are affected are the ones who are really driving the change or driving the programs that are needed. Otherwise, it will just be, very surface.
So what do we do with the second question raised, which is to be talking about not just race, but rather racism? And I just want to know how you're responding to that in the context of this conversation, which is about race and place. How do we talk in a way that is constructive about racism and structural racism, and perhaps recognizing it and working around it? I mean, it's and again, for many people, it's a concept that we've been talking about for a long time. Right. For some people, it's a concept that is somewhat new.
So we have the privilege at my organization to sit at the table with 8 other what were called racial equity anchor institutions that are funded by the Kellogg Foundation. And it's to really look at the question of racial equity as a nation. And I have to commend Kellogg Foundation that in 2010, they really made a commitment to racial equity. They had a whole process which was called healing circles. It's a long process. It's taking 30 people at a time and really spending the whole day and talking about what has racism taken away from you? And it has taken something away from all of us. So those healing circles take a lot of time, but it provides an opportunity to really understand what each of us have experienced and to really have that just human connection to each other. And so that aspect of connection is really important. How you also design programming, like these panels, that kind of thing, is really important. At the same time, though, this has happened to me too many times, there's also the danger of tokenism, right? That happens a lot. Right? Oh, let's just get one of each, right? And let's make sure they each speak. That's tough too. So it really...
That's never happened to me.
No, never.
Right? No.
Never.
One thing that we've done, we focus very heavily on evidence, and we focus on data, and it's kind of a safe zone for us in terms of framing conversations. And so this past year, we funded a survey on discrimination, and you participated in some of
It was
the rollout on that. But it was with the Harvard School of Public Health and NPR, and it was a survey of more than 3,500 people in America, and it looked at people's individual personal experience with discrimination. And it didn't matter what group you looked at, whether you were looking at whites or blacks or Native Americans or Asian Americans or LGBTQ. Everyone of those groups, a certain percentage felt that they had been discriminated against in all kinds of different areas. But the level of discrimination experienced by Black Americans, by Native Americans, by Latinos, was far higher than any other group. And the power of doing this with NPR is that they are incredible at telling stories. And they ran more than 40 stories coming out of this, of people's personal experiences. So there was one that was very powerful. It was a simple story. It was a young couple, Gustavo and Laura, and they were looking to rent an apartment. And I forget what city it was in. But Gustavo called the number over and over again to try and get the landlord to call back about the apartment. and never got a call back. Laura called, and within 5 minutes, got a call back from the landlord saying, yeah, it's available, we'd love to rent it to you. And it was clear that because he left his message saying, I'm Gustavo, they didn't call him back. And I think it was something like 30% of Latinos said that they had been discriminated against when it came to housing. So the power of the data and the statistics paired with the personal story that was told on radio in their own voice, I think helps a more general audience see these issues in their reality.
I'm all for the media, because of course I'm a part of it, and I believe we play a big role in actually informing or misinforming. Okay, we've got 1, 2, 3. We've got a question there? Okay, let's start here and we'll go that way. And just say your question kind of quickly, and let's take those back 3 questions. Just kind of speed round.
Yeah, I was wondering on the issue of how to talk about race and how to communicate it to the public, whether it's important in panels to have disagreement. Like, I've been to a lot of panels where I agree a lot with what they say, but all the panelists agree. And I think the way forward is with disagreement and not like having a straw man, but I just wanted to hear your thoughts on that.
How to work through disagreement. Yeah. Okay, yes. There was another question. Who else had their hand up, right?
Thank you. Thank you so much. It is less like reading To Kill a Mockingbird for me when the guy was just talking, and like how the discrimination is so much penetrated in American society and like especially the history given. But there are so many other forms of discrimination which are like in especially South Asia, like caste-based discrimination. There are Dalits, there are the untouchables, the gypsies, they're nomads, and they're granted even basic citizenship due to their special like roaming and nomadic lifestyle, and nobody talks about that. And these people are invisible from this discussion and the conversation. For me, it's like I'm from people of invisible community, and it makes me feel that these problems are only existing in these big rich countries like US or in Europe, and like we are basing these caste-based things since thousands of years. And we have limited access to different things, and I enjoy the conversation, but it doesn't relate to me, doesn't relate to my community, and I wish I could take back this lesson back with me. Thank you.
Thank you. There was another question right back there. Yes, the hand.
Hi.
Oh,
Ann,
okay, we've got great in the pink. Go ahead in the pink.
Hi, Ann Leffler, and I just want to ask. Language is so important when we talk about these things, and racism and equity are very charged topics. When you think of equity, you think of data sometimes. I'm wondering if there is a space for kind of the heart side of this when I hear you talk about your childhood experience in Philadelphia. To me, it's that sense of belonging. Can we measure belonging, and can we identify places where people of color feel like they do belong? Because, when you feel like you belong everywhere, then that's where you start colonizing places. So I'm just curious if a sense of belonging is part of this conversation.
Thank you. And we'll take your question in the back, the person who has.
Yes.
Oh, all right.
Sorry.
Go ahead. Well, go ahead, yeah.
Joseph Kunkel, Northern Cheyenne tribal member from southeastern Montana. And I'm talking about the narrative. We talked about forgotten people. We talk about colonization. I've been here for the past 2 days. I'm looking around. Not many natives here. And I talk about storytelling. And I thank you, Richard, for the Cultural Health Prize that highlighting the Southwest work. But how do we kind of elevate the stories of these forgotten peoples? We're standing on tribal land. And so I'm thinking about how can we elevate those stories, share those stories, and create more awareness of the injustices that are going on in our tribal communities here in the States.
Okay, we've got 15 minutes. So we're going to answer this round of questions. You guys want me to repeat more or less? Or do you? Okay, so one of them was, should we be talking a little bit more and challenging each other in terms of agreeing on everything? A commenting about untouchable and invisible communities, which I think right now is so pertinent to what is happening in our country today with children who are being transported and we can't even talk to them or know where they're going. The issue of language. By the way, in my newsroom, we never use the word minority, and we do not use the word illegal to refer to a human being. The heart side, the issue of belonging, and how do we bring up stories, in this case, particularly of our First Peoples, Native peoples. So Go ahead, Kathy.
So in terms of kind of dissenting opinions, there's a new lawsuit that a group of Asian Americans have filed against Harvard that is trying to move away from a holistic set of considerations for admission and just purely going to merit. This has actually caused a great deal of consternation in the Asian American community, let me say the progressive, which I identify as progressive, Asian American community, because it has been so important for progressive Asian Americans to really understand our common history on civil rights, working with the African American community, the Latino community, Native American community, women's community, and to understand that all of our fates are tied together. And then to have a conservative wing of our community that is financed by people who are just trying to take down affirmative action, getting that filed, and then the DOJ, the Department of Justice, picking it up, like plucking it out of hundreds of cases to really try to see how DOJ can support it. It's really going to continue to drive a wedge. And that's what the fear is always, is that somehow the model minority, which Asian Americans are always labeled as model minorities, is going to create a wedge across communities of color. So there are dissenting opinions, at least certainly in our community, but I also find some of those other sentiments actually really dangerous sentiments, because there is, in a lot of those communities where we've talked to them, the conservative, there's also a lot of racism embedded in some of their legal arguments. And so if what we're trying to do is think about having a country more of belonging than ascribing to the most base levels of racism among ourselves is not going to get us there.
But at the same time, and okay, you got some applause for that. At the same time, it's so important to kind of bring these conversations up to the forefront, and a lot of people aren't even aware of the level of analysis that's gone into this conversation from the Asian community and specifically progressive. Kevin or Rich?
I wanted to talk about it from a holistic perspective as well. When you think about, we talk about YMCAs and communities as being probably the most diverse door that people go into. When you go into a YMCA in many communities, people from all perspectives get there. When you think about belonging, I think how you get to belonging is having an opportunity to connect and understand differences and value them. The YMCA provides an opportunity for that to happen, and that's real. When you think about, in some instances, you will see a person who works on Wall Street with a young boy who's 16 years old who wears his pants kind of low, but they have an opportunity to connect. And that's real. That's when belonging becomes an opportunity. So when we say about the YMCAs and other organizations, you belong to that organization. And thus, we create a community within a community. And I feel really strongly the way we attack racism is getting to understand each other's perspective, valuing it, and dealing with it from a real, I don't agree with everything Rich said. We have very different perspectives. Rich grew up in Princeton. I grew up in South Philadelphia, yo man. So, but there's a commonality that we can connect with one another. And we have a perspective about what we want to accomplish. And so we can belong to one another and each other and have perspectives to help us solve issues. So that's the belonging that I think is pertinent for our organization.
I want to reflect on the question about language. One of the things that we think about as a foundation is, how do we operate in a time in our lives where the country is more polarized than ever? How do we create spaces, bring people together in the way the Y does, where people who have different perspectives can come together and look for that common ground? And language can either bring people together or very easily drive them apart. So the words that you were talking about in terms of racism, racial equity, social justice, can be polarizing terms. And so, we do a lot of work in terms of thinking of, okay, how do we talk about these issues in a way that doesn't end the conversation, that allows people to come together? So, the way I talk about equity is about opportunity, and everybody having a fair and just opportunity for health and well-being. And that to do that, you have to remove the barriers that keep a lot of people from ever accomplishing or achieving health and well-being. And I try and tie it to what we claim are American values. That idea of opportunity is a fundamentally American value. We talk about liberty and justice for all in the Pledge of Allegiance. So there are ways that we're looking to try and bring people together so that it's not just people sitting together who agree on everything, because we're not going to get anywhere if it's just one camp talking to themselves that agrees on one, another camp that disagrees, they're just talking to each other. So we're looking for those ways to come together, and partnering with groups like the Y for us, we see as just a tremendous opportunity to help those conversations flourish.
Okay, more questions. We have a question right here. And then just, if you hand the microphone over to that side, there's another question over there. Yeah, go ahead.
I have a question. And Kathy, I want to thank you so much for lifting up the Chinese Exclusion Act that happened in 1882. And it reminds me of the fact that following that was the Rock Spring Massacre that happened because white miners were threatened by the Chinese that blamed them from unemployment. And so that's the reason why that Exclusion Act happened. But if we know our history, we know that in 1882, the Chinese Exclusion Act happened, but in 1830, so that the Trail of Tears happened when the Indians were removed and forced from relocation. And if we know our history also in 1825, we know that Seneca Valley, which was founded by free African-American slaves, but it was burned down and removed to make room for Central Park in New York. And my question, when we talk about place, can we talk about also when people have created place, how people was forcefully removed from place? And I'm just wondering if we're talking about health, is trauma passed on from generation to generation and generation? And how is my health affected by what my ancestors went through? Is the health of Latinos or Asian Americans or Native Americans in this country, is their health affected by the trauma that their ancestors went through when they were forcefully removed from their place?
Thank you. You can pass it down this way. So I love the fact that you asked that question, because I've always been interested in, again, the ones who do not have in our country. And so when I had an opportunity to work on my documentary series for public television, America by the Numbers, looking at demographic change, data, storytelling, I wanted to tell this story of who are the women who lose their babies before their baby's first year of their first birthday. Who are the American women who are experiencing infant mortality? Turns out that one of the highest rates of infant mortality is in Rochester, New York. Highest of Puerto Rican women and one of the highest of African American women. So many babies die that they have a special place in the cemetery for them. And what we put on the air for the country to hear was, at that point, quite controversial, because we talked about toxic stress. And we were questioned by editors who said, "What are you talking about? This is not scientific." And then, in fact, you go back and you look at the science, and the science is there. So toxic stress, which is kind of perpetual, prolonged trauma, not having a safe place, being hungry all the time, worrying about how you're going to pay the rent, those kinds of things do in fact embed in us. But thank you so much for that question. Sorry that I had to answer it. Go ahead, your question is.
I'm Steve Patrick. I work at the Aspen Institute. I run something called the Forum for Community Solutions. And one of the things we do is implement a fund that funds communities around equity and opportunity for youth and young adults, from the Hopi tribe to rural Mississippi to Philly. And beyond. And our network has been heavily influenced by the Angela Glover Blackwells and the Manuel Pastores of the world. And last month we convened them, and John Powell spoke to this whole network of grassroots folks. And, so I wanted to double down on the question about belonging. I think Powell's influenced us a lot around othering. And I wanted to ask you all to speak to the moment we're in, because we had a moment over the last 8 years or so where we started to double down on belonging in our culture and acknowledge the atrocities and begin to move towards truth and reconciliation. We're not nowhere near that. Now we've doubled down in this country in terms of the current administration on othering. And so how do we think forward about belonging, and how do we help shape the narrative in a way that doesn't trigger a white supremacy frame, given that we're stuck in one right now, and triggers belonging? And that's the question.
And so those are two really interesting perspectives, belonging, and on the other hand, the acknowledgement that there may be toxic trauma that has been handed down, and how do we kind of wrap our heads around that? Panel.
I would say one of the things, well, over the last year and a half, we've seen a lot of movements, whether it be the March for Science, Me Too, Black Lives Matter, all of them very, very important. The March for Our Lives, the Parkland kids, all really, really important. And how do we start to bring them together? Because in the end, they're all about the communities we care about, and really are trying to say, no, I and my people matter. So how do we as activists, how do we as funders, how do we as people in our communities think about how we can stitch these things together and really have people make connections, maybe it's the Y or other places, to really bring those movements together. We have a really important election coming up in November. And the more that we can bring people together to find a common agenda, the more we're going to be able to really fight what's going on, both at the grassroots level, at the policy level, and certainly at the ballot box.
And you know what, Kevin, I'm going to come to you, and Rich, you'll take us out. We've got like 3 minutes left, so go ahead.
Well, as I think about othering, and I think about the movements that have happened, I haven't read it yet, but I will reference it. The New Power. Have you read that book yet? It really talks about you can't harness that anymore. In this day and age, movements happen at all levels. And to try to harness them is not the direction that they're going. I have a lot of confidence in the young people in this country. I look at what they've been able to do and their abilities to use this digital platform to engage folks, to move them in the directions that we think are in the best interest of our society. I can't get hung up in some of the issues that are happening with this white supremacy perspective, because that would prevent me from being hopeful about what the future will be. So I say we have change makers we need for communities we want, and I focus on who they are and what they're trying to do. Because if you look at what the people in the Florida shooting were able to do in a very short period of time and where they're going, they're talking about how do we build a better civic society. Yep. And that's what we have to be focused on, I believe.
Okay, Rich.
Well, I'm going to end it on hope. When I look at our change leadership programs at the foundation, these are focused on giving skills and providing networks for those at the community level who are identifying the problems that are there and are working towards solutions. And I get hope because when I talk to people in those programs, they know what the problems are, they know what the solutions are, and all they need is some support in terms of resources to get the job done. And they understand the danger of othering. They understand the importance of increasing the circle that includes the we. And they know the dangers of things like toxic stress. And if we don't address those at the earliest ages, that we are going to have big problems. But I get hope from what they say to me about what they are able to accomplish in communities around the country.
Amen.
And I'm just going to say, please listen to Latino USA.
Yeah.
Please take out your phones and subscribe. Please subscribe to In the Thick, which is our politics podcast that talks politics with a lot of laughter, but from a POC perspective. We're all in this together, and I firmly believe that there's just a lot of talking that needs to happen. So I'm doing a lot of that talking and trying to see people with whom I may completely disagree with, but I want them to see me and have the capacity to have a conversation. that is complex in our country. And I just really want to thank all of you, and to our panelists, to Kevin, to Rich, to Kathy, and to all of you. Have a great rest of your conference.